Today we're here with
Dan.
And he's going to give a brief testimonial on his experience here at Fox Valley Health and Rehabilitation. How are you doing today?
I'm doing great.
Good. Dan, would you please elaborate on what health problems you were suffering from? What first brought you to Fox Valley Health and Rehabilitation?
Well, I was diagnosed with a herniated L5-S1, severe chronic pain. I couldn't even put on my socks. I tried working with it, didn't work. I had to get dressed in the morning, and it was just pretty severe. I was told I needed surgery by my medical doctor, in which I did not want to do. I'm more a natural type person. Is there possibilities out there? And that's when I found the DRX advertisement in the Kendall County Record, and called the doc and spoke with Lisa, and set up an appointment, came in, brought my MRI, and which we went over it, the doctor, and it was clear that I had a herniation in my lower back and bulging other discs. He said in which he could help me, and so within a few days we had started the DRX 9000. So instantly, the first time I got on the DRX, I felt the severe pain relief as it was, stretching me. I wasn't skeptical about anything. I try to, be open-minded, and it really helped right away as far as the severe pain. It took a while for the severe pain to be gone completely. When you get on the machine, it relieves that pain, and eventually it comes back a little bit. But after a few visits, that severe pain, I could put on my socks again, and I was able to do other things around the house, movement. Still laid flat on the floor. Eventually, what we got into was the physical therapy, and the physical therapy of retraining the core, and everything is the key, obviously, to keeping and maintaining healthy spine, because it holds you in place. And ever since, which I believe was a year ago, sometime this week or so, that I had come in here, I can do just about everything. I'm a bricklayer by trade. I work in construction. I've recently been remodeling my house, some of the interior of the house, and ripping up tile floors. And I'm sure this is not for everybody, but it's worked fantastic for me. DRX is the way to go, I believe, 110%, and which helped me also change my lifestyle. So, is there anything else?
Yeah, I want to get into a little bit of, you've been done with your actual therapy for quite a while, and you've been able to maintain. It's not that you've gone a whole year for treatment.
Correct,
Yeah.
Right. Oh yeah, I've been done with the therapy. It was 20 visits, I believe, and that was starting right away, 3 days a week, and then broke down to a couple days a week. So 6 weeks maybe, I think my total therapy was on the DRX. In which, in towards the end of that is when we started doing more physical therapy and training different ways to train the core, strengthening. I'm able to work out now. I work out pretty consistently 3 days a week, do my core training, which I enjoy doing now. Today is my day for that, so I can't wait to get home and do that. It's a changed lifestyle. I was told by a doctor I used to have that I needed to do it, and I just kind of didn't listen, and then eventually the degenerative and the disc kind of wore it down and gave me problems. So, but I've been working now pretty consistently, and generally there's no problems. It still lets you know every now and then if you're doing too much, but it's not a constant pain or anything severe. It just kind of a little touch lets you know, hey, I'm back here.
Take care of me.
Yeah, take care of me. Watch what you're doing.
Overall, how did you find the care here? Would you recommend us to others?
Oh, I find the care here excellent. The people here are excellent people. They're very nice. They treat you as family, I would consider, and I would definitely recommend. In fact, I'd have recommended to quite a few people. I pass the cards out, and when I talk to somebody at work, because I'm in construction, I see a lot of guys, with back problems and pain, and you know, I always mention talking to them, and if they live in this general area, or maybe I would talk about the DRX and what it did for me. Surgery is not necessary, I don't think, unless, of course, it's a severe thing. But I would always recommend looking into the DRX 9000 or some type of chiropractic that could possibly help you before you go under the knife. Because if you can be helped, I would recommend that highly.
Nice.
You know, surgery's not the way.
Well, thank you very much.
You're welcome.